So Megan is going to be the person responsible for all of the laser, and she is a dental hygienist. She has a master's of science in dental hygiene education. She was an astounding adjunct professor at the University of Minnesota School of Dentistry. She worked with a lot of the dental hygiene students, and she works primarily with our practices on clinical coaching. She does a lot of coaching far off from the foundations of clinical care. So yes, she can help incorporate fluoride programs and perio programs and staging and grading, but also taking it up a notch with how to expand your practice with Botox as a dental hygienist, how to incorporate lasers, utilizing your restorative functions. And so very, very talented in that aspect. She is still in private practice. And so all of the coaches on our team have a foot in private practice. And that's one of our core values for us to stay relevant in what's going on in dentistry, not just teaching it because that's what our passion is and in best practices, but also living through it. So without further ado, I'm going to pass it on over to Megan so we could get started in the agenda for lasers.
Hi, everyone. Thanks for coming on to the presentation. I see actually a familiar name, a prior student of mine at the university. So shout out to Bridget. And everybody else, if you want, just to point out at the top of your box, there should be 3 little dots. And you can actually edit and rename yourself. So that might be helpful as far as continuing ed credits at the end. So we know who is in attendance today. Okay, so I'm excited to talk to you all about lasers today. I want to reiterate kind of what Shannon said, that this is merely just a glimpse into our clinical hands-on training that we provide to teams. By no means should this lecture today be considered a laser training or a certification. Typically, laser trainings in themselves are anywhere from like a half a day seminar to a full day seminar. The training that we provide that I'll come out to your practice for is typically 4 hours in length and involves a lecture and hands-on and is specific actually and catered to the lasers that you have in your practice that you use in your patient care. We can also work through perio protocols and how to implement the laser based on your patient population demographics and your current perio protocols. So by no means is this a laser certification today. It's just kind of a informational session that allows you kind of an idea of how lasers can be incorporated to clinical care. So laser to start is an acronym for light amplification stimulated emission radiation. What's important when you think about lasers and laser use in your practice are the characteristics of a laser, the type of laser you're using. So that's kind of the foundation to know which type of laser you have and whether or not it can be used for hard or soft tissues. The diameter of the fiber, the treatment time it's used, the wattage, the mechanism of treatment, the depth of penetration, as well as the effects, the settings, the performance, and then the tissue health that it's being used on. Is the tissue healthy? Is it inflamed? And then also being careful with lasers. It can be detrimental to different tissues within the patient's mouth and then also externally outside of your environment as well. Something to keep in mind when using a laser is something called the golden rule of lasers, which is to use the lowest amount of energy possible to perform the procedure. If not, damage can occur to tissue and bone, and that can be detrimental and cause sensitivity for patients. So when using a laser, you have to give it extra precautions in regards to patient care. We are going to be talking about 2 very common lasers that are often used by hygienists in clinical practice. The 2 that research shows are lasers that have light that can penetrate and are absorbed by melanin and hemoglobin are the ND-YAG laser and diode lasers, 2 of which are probably common lasers that you've heard about or read about or seen research about. An ND-YAG laser is the first type of true pulse laser to be marketed exclusively for dental use in 1990. So it's been around for good 34 years and has really taken off recently. It's near infrared wavelength of 1064 nanometers, and it's absorbed by both hemoglobin and melanin. And we'll talk a little bit more as the presentation goes on as to why melanin and hemoglobin are important in regards to lasers. And it is primarily used for periodontal treatments because they are effective for debridement, disinfection, and bacterial decontamination. The next laser that might be a familiar sounding is a diode laser. It's one of the most popular lasers in dentistry, and wavelengths are highly absorbed in the melanin and hemoglobin found in the soft tissue. When tissues become red or inflamed in color, they have more pigment and or melanin or hemoglobin, and that's what increased bleeding occurs from. And the laser is specifically attracted to those increased color changes in the tissue. So diode lasers work on soft tissue and they're bactericidal. So now that we know a little bit more about the type of lasers and how they work, we're going to talk about the interaction specifically that they can have with tissues. So here are 4 different interactions that lasers can have with tissues in the mouth. Absorption is when molecules in the tissue known as chromophores absorb the photons, and then they convert to heat, and that's what is impactful in reducing the bacteria within the pocket. Transmission, where it passes through a substance within the mouth, whether it's tissues or tooth. Scattering can occur where the laser enters the target tissue and then it scatters in various directions. This is usually not very helpful because you want the laser to penetrate the area that you're working on and not necessarily scatter. Reflection is when the laser beam bounces off of the surface with no penetration or interaction at all. And this is the interaction that can be quite dangerous to patients in the operatory, the clinician that's using the laser, and then also people that are walking by as the laser is being used. Here's the diagram that just shows the interactions. And this is just a primary example as to why you have to be very careful when you're using a laser and wanting to implement it in patient care. So absorption is the most important interaction when using lasers in dealing with periodontal disease or gum infections in general. Each wavelength has a specific chromophore that absorbs energy. So that's what the wattage and the different wavelengths that you use are specific to the laser and the type of disease that you're treating. Diodes and NDAs, the 2 lasers that hygienists most frequently use in clinical care, are mainly absorbed by pigments such as hemoglobin and melanin, as I've been saying. But then some lasers that a dentist would use, a CO2 laser, for example, are absorbed by water and hydroxyapatite. Chromophore is a molecule which is absorbed light at a particular wavelength and emits color. And here is just an example of the diode laser and NDA are in the hemoglobin melanin range, and then the erbium and the CO2 laser are attracted more to water. So a dentist is the person that can use the CO2 lasers because they can cut through bone and are used for prepping for extractions and endo and prepping for fillings. Some factors influencing absorption of lasers are laser wavelength, power, the tissue composition or thickness, or the health. The pigmentation sometimes of tissues can also impact laser effectiveness, whether the surface of the tissue is wet, the angle of your beam, the amount of time you're using the laser, as well as if the laser is in contact or non-contact mode. So here is a big question that is, this slide is a great slide for reference as far as what lasers can be used for in dentistry. There's maybe even more. These are the ones that I'm most familiar with and found a lot of research on as I've used lasers over the course of the last 13, 14 years when I've been practicing as a clinical hygienist. I've used lasers in treating periodontal disease for those full 13 years. So soft tissue management, gingival recontouring, gingivectomies, cold sore management, canker sores, lip or tongue tie revisions, coagulation after extractions, biopsies, incisions, and drainages of abscesses during endo or before an extraction, crown lengthening, laser bacterial reduction, periodontal therapy or cellular debridement, reducing bleeding, and then also increasing healing. So the items all listed here, how lasers can be used, the ones that are highlighted in yellow are the things that hygienists can do when using a laser. So soft tissue management, cold sore management, canker sore treatment, laser bacterial reduction, periodontal therapy, and then both of those reduce bleeding, increase healing. So now that we know a little bit about lasers and how they work with tissues, we're going to just do a quick refresher on periodontal disease. Um, so periodontal disease is the result of toxins produced by bacteria and plaque and a vulnerable host, which creates an inflammatory response. This is taken from the AAP. Perio prevalence in your practice and in the US, it's estimated that 47.2% of adults have perio. After the age of 65, that increases to 70%. And then even some immune deficiencies that patients have regarding cardiovascular disease, diabetes, respiratory disease can even make it an even more increased risk for patients. So we know that at least 50% of our patient base should have some form of gum disease according to the national averages. Historically, one way that dental hygienists have treated periodontal disease over the years is non-surgical perio treatment, which is your typical scaling and replaning, where you're cleaning the bacteria and the plaque and calculus from the root, and sometimes using ultrasonics, typically followed by irrigation or a rest in placement, and then a tissue check 6 to 8 weeks post-treatment, and then maintenance therapy ongoing. We know that periodontal disease is managed, not cured, so it's an ever, once a perio patient, always a perio patient kind of mindset. So typically, whatever ways we can remove bacteria or help treat the patient's level of disease is best and most effective. And so we're going to talk next about how lasers can be used in regards to bacteria invasion and the body's response. So thinking about the bacteria that puts patients at risk for disease, or sometimes patients that are stable or healthy and had a history of periodontal disease, they're always at risk for that bacteria load to come about and be reinfected. So your body's response to bacteria is to send fluid to the area to flush out the infection. Your circulation becomes stagnant and swelling occurs, and gum tissue then becomes puffy and dark and inflamed and bulbous, which we know that diode and NDA lasers absolutely love, that dark red diseased tissue. So we're suggesting that in regards to lasers in your practice, that you use them as a response to the bacteria in the biofilm and help shift the host's response to that bacteria in order for the gums to heal. So a first line of defense in our preventative approach can be lasers. The heat from the laser has a direct effect on viruses and bacteria, and it can eliminate bacteria via bacteria reduction to disinfect and reduce bleeding. And then research is kind of mixed, but it can show that it shows that bacteria is reduced for anywhere from 6 weeks to 6 months. So it is impactful in regards to reducing those bacterial loads. 3 different types of ways that lasers work are biostimulation, low-level laser therapy, or LLT, which is the canker, aphthous ulcer treatments, laser bacterial reduction, which is like a disinfection of the mouth. Think of it as like a pre-procedural rinse that you would have a patient rinse with before beginning care. And then laser assisted periodontal therapy, or LAPT, that would be in conjunction with scaling replaning. You've anesthetized the patient and you are digging down deep into the pockets to remove all the biofilm and bacteria. LAPT would be something that you could use. So oftentimes people, I think, are maybe confused between the difference between LBR and LAPT. LBR is bactericidal. It's like a very quick process, something that can be done at routine hygiene visits. It's lower power, and it's just a very quick process. LAPT is therapeutic in nature and is meant to be used at a higher power, and to actually reduce the bacteria related to periodontal disease to help impact and improve the actual process of periodontal therapy, whether it's scaling or planing or you use an EMS or whatever it is that you do in your practice. And then a lot of people have questions about lasers effectiveness. The American Academy of Periodontology research is actually showing that it is just as effective as non-surgical treatment, including SRP alone. It just cautions to the fact that damage can occur if it's used at inappropriate wavelengths or power levels. But otherwise, it's right on the American Academy Periodontology page. It's backing use of lasers in practice. So one question is, can all hygienists use the laser? No, not all, but we can in Minnesota. So if you are based in Minnesota and attending the webinar, I know for a fact the Minnesota Board of Dentistry regulates the dental procedure that the dental hygienist can perform and not what type of instrumentation or equipment is being used to perform that procedure. So if a patient is having scaling or planing, the Board of Dentistry does not incur any or doesn't instruct on what actually is being used during that process. It's just the act of doing scaling or planing. It is recommended that if you do have laser training or laser certification, that you keep the documentation on hand for that. Next, we're going to talk about laser safety, just some things that you would need in your practice in order to use a laser. One and most important is a laser safety officer. This person is going to make sure that all of your equipment is up to date, being handled safely. Also to check for your tips accuracy and to make sure everything is up to snuff. Laser protective eyewear is very important. You should have it for yourself as well as the patient. Anesthesia is recommended for patient comfort, suction, complete understanding of your laser and its settings. So whether that's having a rep from the company come out and speak to you about your laser, or looking at the handbook, either way to understand what settings are safe for the patients and the use, that's important. That's something I can help you work through too if I come out for clinical training with lasers in your practice. You should have a sharps container, a way for you to document laser use in your notes, and then a danger warning sign to be put outside of your operatories. It's the most important from that reflection and that scatter part of the laser that can be detrimental for patients for you to wear laser eye protection, because if it scatters or reflects off of a tooth, it could reflect back into your eye. So the point of the laser eye protection is to keep your eye safe as well as the patient's. And you should always be utilizing safety checks and do not point the laser towards any bone or tooth structure or anybody's eyes. This is an example of the laser in use sign that can be kept outside of an operatory, so that anybody who's walking by knows that they should either avoid the area or not look directly into the room for fear that there's some sort of reflection or scatter of the laser that occurs. Okay, next we're going to talk a little bit about treatment planning. I'm going to pause and just encourage questions so far in the chat. Feel free to put anything that you have a question about in the chat. I'm going to cruise into treatment planning, and then I can look at the chat when we have time for questions at the end. So next, we're going to just talk about treatment planning using lasers with our patients. So how many of you have had a patient like this in your clinic? And think to yourself, write it down. What was the treatment plan that you made for this patient? What code did you use? Feel free to add it to the chat box if you are able to. Otherwise, just think in your mind, like, if I saw a patient clinically that arrived in my chair and had tissues like this, what have I historically done? More times than not, I feel like hygienists probably do a D110, a prophylaxis. some maybe treatment plan, the D4346, scaling in the presence of gingival inflammation. And then depending without x-rays, it's hard to say, but it could be 4341 or 4342 scaling and replaning. But either way, we should, as dental professionals, look at this patient and recognize that this is not a healthy mouth, that this is inflamed and there's erythematous tissues. And more than likely on probing, you're going to experience some bleeding. So this would be a patient that would be a great candidate for laser use in your practice. It could be a regular recall appointment, and it could be something that they're rescheduled for because they have a lot of tartar buildup and you're using it during a 4346 or an SRP appointment. I'm sure a lot of you have also had patients like this in your chair that have what appears to be some form or varying level stage of periodontal disease. I'm sure there's probably, looking at the calibrated attachment loss and recession, probably anywhere from 30 to 40% of bone loss on the x-rays. And this is also a patient that maybe you've treatment planned for scaling or planing, but would also benefit from using lasers during that therapy to reduce the bacterial loads in the pocket. One common, when I'm working with clients and consulting, one common thing that hygienists will say is, I've been seeing these patients for years and they're not going to be receptive to this new treatment. They're going to wonder why I've never done it in the past, or why things like this haven't been mentioned previously. This is just a little excerpt from a coaching point where you could say that I've been taking a pretty conservative approach to the lower left by debriding the area as best as I can in a normal preventative visit. However, I'm getting really uncomfortable with the level of bleeding that presents today. And so the best course of treatment would be for me to do a debridement and use the laser to disinfect your pockets and have you back in 90 days to reevaluate and see whether or not tissues have healed or we have to do something further. And then just end with, I can go ahead and get started. Do you have any questions for me? So this is something that can be easily incorporated into your patient care, and patients might be really appreciative of the fact that you have this new technology, or that you have started to take a more preventative approach in their care and reducing bacteria in their mouth. It's important to tie laser use to long-term benefits. Sometimes it can be beneficial for patients to have it before restorative. And even healthy patients sometimes might appreciate, just like fluoride for patients that don't have a history of decay or haven't had decay in a while, might still want a fluoride varnish. Some patients might also want a disinfection of their tissues to make sure that the bacteria is kept at a minimum. It can also be beneficial for a patient that has this type of inflammation and disease in their mouth to have LBR done prior to, in order for a good restoration to be placed. So for an example, a patient that has a filling that needs to be done, or a crown, you could say you have an appointment to get a filling or a crown done with Dr. Jen. In order for her to get a good fit on your filling or crown, we're going to do some laser bacterial reduction to remove some of the bacteria from your sulcus so that the tissues have the ability to heal before you come in for that restorative appointment. So it's a good overall comprehensive approach to care, whether it's in your hygiene chair or the patient has to come back for restorative. Because how many times can I say that I've been a hygienist in my operatory waiting for my dentist to come in for an exam, and the dentist is taking forever, and I, not knowingly, they are just having probably the most terrible time getting the patient to stop bleeding, having a hard time getting a good fit on a crown, or they can't get the bleeding to stop to cement a crown. So this can also be something that is useful comprehensively, and really make things a lot healthier for the patient in the long run. So looking at this tissue, lots of inflammation in the lower arch, lots of redness around the teeth marginally. I look at this patient and I think, oh, if this patient had to have a DO filling or some sort of crown, they're probably going to bleed a lot during their appointment. So this would be a great opportunity to inform this patient of the amount of inflammation. If they have a cavity they have to come back for, that it would be also helpful for the dentist for them to have a procedure done with the laser. So there are ways where lasers can be used in the restorative chair, and not just hygiene based. So we need support from all the staff in order to incorporate lasers into your practice. So for example, say the patient hasn't been in for hygiene for a while and they have a limited exam and they come in just to see the dentist and they get a filling done. An assistant or a dentist can also tell the patient after they've done like an emergency filling on a tooth that your gums bled a lot today. We're going to get you scheduled back for your next recall appointment. And I'm also going to add this laser bacterial reduction code to your appointment so that the hygienist knows that they should do that for you at that time, to reduce your bacteria. It encourages also further conversation with the dental hygienist and the patient about disease-related cleaning codes, if the patient would qualify for inflammation, scaling in the presence of gingival inflammation, or maybe scaling and replaning. And it also gives the hygienist a little bit of a heads up of what to anticipate during the appointment, and planning for assessments and x-rays. And it also just shows that the office can really provide continuity of care and that everybody's involved in comprehensive care. And from the time the patient walks through the door to the time they leave, that everyone is invested in making sure that the health of their mouth is the best that it can be. It's also great when a patient has had laser bacterial reduction or LAPT in the hygiene chair and they have to come in for a filling, for people to compliment the patient on the results from it as well. So wow, Justin, we completed that laser bacterial reduction procedure at your last hygiene visit, and it was really beneficial for the health of your tissues today and made our restorative procedure super easy with the doctor. So it adds value to all aspects of care within the practice, and also provides patient accountability. So the patient also, maybe they had to go through a process that they weren't willing to do it, but they understood the reasons behind it. And then also it was complimenting a coworker and complimenting the fact that the patient had the procedure done, which just reiterates that it was a good choice. Next, we're going to talk about codes and fee recommendations, which I'm sure is at the forefront of a lot of your minds. A code commonly used is by our clients is D4999, unspecified periodontal procedure by report. It requires a narrative and or documentation, which all periodontal procedures that you perform should have documentation and a narrative associated with it, to help patients and the clinician that sees the patient next or insurance to understand why procedures were completed. Some recommended fees for LBR would be $50 to $75, depending on your area, your patient demographics. And then LAPT would be localized. We recommend $75 for localized perio and $125 for quadrant perio. And then just understand that benefit plan coverage varies. This is something we can unpack together when the time comes. If you have us out for clinical training on lasers, that's something that we can look at specific to your practice. So lasers in your practice, what that looks like, benefits to your practice and your patients. It increases patient health, better treatment outcomes in your restorative chairs. It expands the skills and increases job satisfaction for your hygienists. It also lets your patients know that you've invested in cutting edge technology to offer them like the most optimal level of care. It can increase profitability at the practice and for your hygiene team, and it allows patients to stay within your practice and receive comprehensive care within the walls of your practice. So it really just is very thorough, and provides patients with the options for lots of care to make sure that they're nice and healthy. What laser training will look like in your practice specifically when we come out, it's typically, like I mentioned before, 4 hours in length. It is a lot more science dense and reviews lasers in general, so everybody has an understanding of how lasers work. We do review the periodontal disease process, talk about periodontal percentages with your practice, with your team. We discuss lasers and patient care in more depth, treatment planning, patient verbiage, codes, fee recommendations. And then the really fun part is that we do hands-on training with your laser. Your team can work on one another get to understand what the comfort level feels like, what it feels like for the laser to be used. And then we also create protocols to implement within your practice. So sometimes patients are wondering, or staff is wondering, if I have a patient that comes in that presents with D43, 46, what does the appointment look like? When am I using the laser? And how is it implemented? And so we work through that together as a team, create the protocols, make sure that you guys are all comfortable with the specific laser in your practice, understanding the wattage and the time and how much should be spent in the pockets with varying level disease. So it's a really fun training. The offices that I've worked with on it have really had a great time, and we kind of all unpack all of the questions and get a lot of good answers for a clear understanding of how to treat patients with periodontal disease within your practice. So thanks for listening. That concludes the laser content.